Nawras and Moaz were born into a war with a health system failing around them. It took 2 weeks for the Syrian American Medical Society and the Syrian Red Crescent to get permission from Damascus to move them 10 kilometres to the capital. The children's hospital wouldn't admit them, so they were kept in a private facility awaiting evacuation. But the government didn't respond to requests to allow them out of Syria.
As a group of physicians, as human, we are depressed that even a simple task to assist kids who are having heart disease have no contribution whatsoever to what is going on inside Syria. We are depressed that the international community has failed us, helping evacuating them to get their treatment that they needed. Unfortunately, we have seen this over and over and over in Syria over the last 5 years. We've seen kids who are dying waiting for evacuation.
A new report from the Lancet Medical Journal says infant mortality rates were decreasing by 6% a year in Syria between 1990 and 2010. But since the war started, they've spiked. By 2013, there was an increase in the number of children dying of 9% a year. There are similar health system failings in other Middle East and North African countries, where so-called Arab Spring uprisings led to protests, changes in government and conflict. Some people in Yemen needed food aid before the war, but now 7 million people are under threat from acute malnutrition. 20 years ago, Iraq had one of the most advanced health systems in the region, but due to conflict and mismanagement of resources, it's facing multiple infrastructure crises.
We have now poor sanitation, we have poor water supply, we have no electrical power, and the health system is deteriorating. In Syria, we are losing people, and the health system is not efficient because any health system cannot work properly under such circumstances of war and bombing and fighting.
The collapse of these medical systems and lack of access for aid is not just a threat to people's health, it's a threat to the entire region's ability to heal itself, claiming the youngest of lives. Caroline Malone, Al Jazeera.